Hi, I'm Nancy Muller, Executive Director of the National Association for Continence, and I'm speaking to you from historic Charleston, South Carolina, where we have our national headquarters. And I'm here with our mailbag because I'm right adjacent to the historic post office at the corner of Meeting and Broad Street, where we have our giant drawer and we collect mail every day from people all across the nation. Most of our correspondence actually comes electronically by email these days, but we still have a post office box here in Charleston. And one of the frequent questions that we get asked comes from men who've had a prostatectomy. And the question is, how long will I be incontinent after I've had this prostatectomy? Sometimes they have already had the surgery and they're very frustrated and bewildered by the constant loss of urine and the inability to control the storage of urine in their bladder. Well, a lot of doctors recommend that men wait a year and see how their bodies recover from the surgery and determine what is done after waiting a year. But more current thinking is that you should seek treatment and intervention when you stop seeing signs of progress during the recovery period. And if after only 3 months you are still leaking and you're not witnessing any improvement, then you need to go to your urologist and talk about remedies and options that can be undertaken. There's no need to continue suffering for a whole year if you're not getting any better. On average, about 25 to 30% of all men following a radical prostatectomy, especially if they've had radiation as well, will continue to have problems with incontinence after a year. And there are remedies. There's a male sling now that is minimally invasive surgery, and there's also an artificial urinary sphincter. But what can you do prior to a prostatectomy in order to minimize that waiting time, in order to regain continence as quickly as possible, and assure you not only of recovery, but also regaining your sexual vitality, including that erectile functionality? Well, pelvic floor muscle exercises are the answer, and they need to be part of your lifelong passion. If you need help doing those exercises, contact us at nafc.org, and we can provide a kit of instructions and audio instructions to walk you through how to do those exercises. We also have pamphlets that describe not only pelvic floor muscle exercises, but also these other treatments and interventions that I mentioned earlier. So from the mailbag in Charleston, South Carolina, I'm signing off.